Hello, my name is Sara. I'm a student nurse, and I'm going to be taking care of you today. Can I just ask your name and date of birth?
Antonio Similia, and my date of birth is 1/27/1990.
Okay, and that matches your band. And how would you like me to refer to you?
You can call me Antonio.
Okay, thanks, Antonio. So I'm going to be doing a full head-to-toe assessment today. It'll be pretty brief, but I'm going to be just checking eyes, ears, mouth, lung, and heart noises. So as I'm going along, if you have any questions, just let me know.
Okay.
Do you have any complaints about pain?
No pain.
No pain? Okay. And do you know what today's date is?
Today is July 21st
Okay, and where are we?
at the Northeastern School.
Okay. And who's the president?
Donald Trump.
Okay, thanks so much for that. We can begin. So what I'm going to be doing is starting on your head. Can I touch your head?
Sure.
Okay. So right off the bat, I have seen that my patient is alert and oriented. He's not in any pain. He seems to be breathing quite normally. He's not in distress. His skin appears healthy and flushed, but normal for skin tone and ethnicity. Okay, Antonio, so I'm going to be palpating. You let me know if you feel any pain. Okay, so I don't see any lesions or sores. His hair appears to be healthy, not brittle. I don't see any dryness. I'm going to be inspecting the ears. I'm palpating the mastoid process, palpating the ears, the tragus. And as I look at the ears, I don't see any redness, any discharge, any signs of infection. Quite satisfied with that. Okay, so now I have a light right here. If you don't mind, first just stick out your tongue. Nice. So his tongue appears to be even and midline. Now open your mouth and go ah.
Ah.
Okay, uvula appears to be midline. Tonsils are not inflamed. It doesn't look like he has dentures. And everything appears to be okay there. You can close your mouth. Okay. Have you had any difficulty swallowing?
Nope.
Any cough? Sore throat?
Nope.
Okay. And chewing is fine? You don't feel any pain with chewing?
No issues with that, no.
Okay. Do you ever clench your jaw?
Yeah, in the past I have, but not too much.
Okay. Okay, so now moving forward, I am also going to check strength, so just shrug against me. Great. Okay, so now I'm going to be putting this light in your eye. I do apologize, it can be uncomfortable, but look straight ahead at my finger, and it shouldn't feel too bad. Okay, great. So I'm inspecting for Perella, and it does look like the eyes are restricting evenly. I would say they were at a 5, and they went down to a 3, but the constriction was even. Okay. You have healthy coloring in your eyes. Okay. So now what I'm going to do is just test your ocular function, and what that means is I just need to test eye movement. So keep your eye on this pen as it goes without moving your head. Okay? Nice. And so your eyes have some nice brisk eye movements. I don't see nystagmus or anything concerning. Keep an eye on it as I bring it in. Okay, great. Thanks for that. Okay, so now I'm going to be inspecting the skin on your arms. Okay, skin appears unbroken. I don't see any lesions or bruises. Have you noticed yourself bruising easily?
Nope.
Okay. I'm just going to look. There's no Janeway lesions, no signs of clubbing. I'm going to check the cap refill. It's under 2 seconds, which is great. Have you put your arms there? And I think I'm ready to collect some of your heart sounds now.
Okay.
Any shortness of breath?
Nope.
Okay. Any pain, chest pain?
Nope.
Okay. So first I'm going to take my diaphragm and I'm going to go to the second intercostal space on the right sternal border. And what I'm listening for is heart sounds, and his S2 is louder than his S1. I'm going to go to the left sternal border, second intercostal space, to listen to the pulmonic. And over here the S2 is louder than the S1. I go to the third intercostal space, which is Erb's point, and I hear even S1 and S2 noises. I go to the fourth intercostal space, which is the mitral, and I hear S1 is louder than S2. And I go to the midclavicular line, fifth intercostal space, and this is the mitral. And what I'm hearing is that S1 is louder than S2. So I'm also going to palpate the carotid artery, and I don't hear or feel a deficit on either side, which is great. So now I'm going to switch to the bell, and I'm going to go back and listen to all of those locations again, this time listening for any murmurs or turbulence. And could you actually lean forward just a bit? Thank you. great. I'm also going to listen to your carotid artery, so if you put your head just a little bit that way and take a nice big breath for me and hold it. And exhale. Turn your head this way and do the same thing. Inhale. And exhale. Okay, thank you for that, Antonio. Okay, so now I'm going to be listening to some lung sounds, so I switch back to my diaphragm. And this time, oh, have you been having any coughs lately?
No, I just tickled my throat.
Okay. So I'm going to be listening to your lung sounds, so every time I put my diaphragm down, just take a nice big full breath for me. And of course, like, let me know if you get lightheaded or uncomfortable in any way, and we'll stop.
Okay.
Okay. Great. So while I'm doing this, I take care to go bilateral and symmetrical so that I can compare the right and the left sounds. And what I'm hearing is equal breath sounds, and I'm watching his chest rise and fall equally. Great. I'm also going to get your lateral sound. Okay, and then compare. Okay, thanks for that, Antonio. I'm also going to have you just pivot a little so I can get to your back without too much trouble. So on the back of, I'm going to be collecting 8 different breath sounds. I'm going to start up high with the bronchial. So inhale. Great. So up here I note that the expiration is greater than the inspiration. And now I'm going down to the vesicular area, or the bronchial vesicular area, where the expiration and inspiration are equal. And I'm finishing off with the vesicular area, where the inspiration is greater than the expiration. Okay, so there was no wheezing, no rhonchi. You have normal lung sounds in your right and left lungs, so now you can turn around. And now I'm actually going to have you lay down. We're going to just do a quick abdominal exam. So when was the last time you had a bowel movement?
This morning.
Okay, and when was the last time you urinated?
This morning too.
Okay, and have you been having any nausea, vomiting?
No.
Okay, do you have any complaints of constipation or diarrhea?
No.
Okay, so I'm going to start off by listening. So at first I go to the right lower quadrant. I'm listening for bowel sounds. And so his skin appears to be normal, healthy, normal color. I don't see any lesions, abrasions, tremors of any kind. Okay, and I'm going to switch to the bell, and this time I'm going to be listening to some of the abdominal arteries. So I start off with the aortic, and then the bilateral renal, and then the bilateral iliac, and the femoral. Okay, and again, no turbulence, nothing concerning. So now I'm going to palpate. I'm just going to press down, and you let me know if you feel any pain or any tenderness. No? Okay, awesome. Thank you so much for that, Antonio. You can sit up now. All right, so now what I'm going to do is I'm going to be inspecting your legs, similar to how I inspected your arms, just checking the skin. Color appears to be normal for your skin tone. I don't see any bruises or abrasions. I'm going to feel your pedal pulses. Okay. Great, and those are strong and regular, +2 as well. So now I'm just going to finish off by testing for some reflexes. So just dangle your legs. Okay, and your reflexes are intact. So do you have any questions about everything we just did?
Nope.
Okay,
Questions?
have you experienced any other symptoms that you want to talk about today?
Nope, nothing.
Okay, well thank you so much for coming in, and we'll get you situated for what's next.
Thank you very much for the
Thank you.
assessment.